Hi, my name is Julie Burkhardt, and I am with the Centers for Medicare and Medicaid Services, the federal agency that administers those programs out of the Kansas City Regional Office. And I would like to talk to you about a new program that was rolled out in July of 2010, the Pre-Existing Condition Insurance Plan program. It was one of the first regulations, part of the Affordable Care Act, and it is for people who have been turned down for health insurance due to a pre-existing condition. And as anyone can imagine, the absence of affordable health insurance can wreak havoc on people's lives. An untreated medical condition can not allow people to go to work every day. It can disrupt relationships with your family and friends, and it can cost people their livelihood in general, and in some cases their lives. In most states, private insurers can turn people away if they have a pre-existing condition. This is the reason that the Pre-Existing Condition Insurance Plan was made part of the Affordable Care Act. It is for those that have been shut out of getting health insurance, have been turned away due to a pre-existing condition, and simply they cannot afford the health insurance premiums. And we all know what a serious illness or injury can do to people who do not have health insurance. It can be a financial disaster. So this new program called the Pre-Existing Condition Insurance Plan was rolled out in 2010 and in all 50 states and the District of Columbia. And it is a transitional federal program until the year 2014 when the new health insurance laws go into effect, and part of that law is going to say that private insurers can no longer turn people down due to a pre-existing condition. It provides people with the same coverage that healthy people pay in the private insurance market and at the same pay that a healthy person would pay as well. So the Affordable Care Act is bringing about affordable health insurance for anyone with a pre-existing condition so these folks can get some control back over their lives. Well, Nebraska has a pre-existing condition insurance plan. As I said, all 50 states do. Nebraska, in this area in the Midwest, was one of the only ones that decided not to run the program at the state level. So our federal agency is administering this program. A person that would qualify has to reside within the state of Nebraska. And if they moved around and they moved to another state that their plan is being federally administered, the same application rules would apply. You have to be a U.S. citizen or in the United States legally, and you have had to have been without health insurance for the past 6 months. Now, this is an incredible health insurance, so you can't have employer insurance and then drop that plan and immediately have access to this plan. Or you can't be on Medicare and Medicaid and drop it. Those are comprehensive health insurance coverages. Then you also have to have a pre-existing condition. And as of July 1st of 2011, all you have to do to prove that you do have a pre-existing condition is to have a letter stamped and dated within the last year, the last 12 months, by your doctor, physician assistant, or nurse practitioner that you have, or in the past 12 months, had an illness, condition, or injury that would qualify you for the pre-existing condition program. So it's very simple to apply and basically to prove your pre-existing condition. The program gives comprehensive health insurance. So it's the same comprehensive health insurance that federal employees get, that Congress gets. It pays for inpatient and outpatient care. It pays for emergency care, prescription drugs. It pays for lab tests. It pays for psychiatric treatment and much more. And at the same price that a healthy person would pay for that health insurance. So a very serious illness or injury is not going to cost you your livelihood and be a financial disaster. The other part that guarantees that is that there is an annual out-of-pocket limit that people will pay. In the year 2012, this out-of-pocket limit has gone down. So once a beneficiary that goes to in-network doctors pays $4,000 out of pocket, then the plan will pick up the remainder of the cost for the rest of the year. Also, there are many other important features to the health insurance. There's first dollar coverage for preventive care, so you don't pay a deductible to get annual exams, to get cancer screenings, types of screenings for your preventive care. There's no lifetime maximum on the health insurance policy, and the ability, you can go in and out of network. So if your doctor is not on the network, you can go out of network, but you're just going to pay a little bit more out of pocket. There are some costs to the pre-existing condition insurance program for all the plans nationwide. It's like any other health insurance. You're going to have premiums, deductibles, and copays because health insurance is not free. Everyone has to pay for that. But it is at the rate that a healthy person will pay if you go to a private insurer to get insurance. In Nebraska, there are 3 choices. There's a standard plan, an expanded plan, and then what's called a health savings account plan. Amongst those 3 plans, you choose if you want to pay a lower premium that may have a higher deductible, or just the opposite with the expanded program, which has a higher premium and a lower deductible. Starting July 1st, last year, the premiums also went down quite a bit. They dropped by 20.5%. So for example, a 50-year-old in Nebraska can get comprehensive health insurance at about $300 a month. These rates are based on people's age. That's the way the market rates are set for even a healthy individual's health insurance. The premiums are going to range basically from anyone as a child to anyone up to over the age of 55 plus is how they're broken out in age, by anywhere from $132 a month on up to $421 a month. And again, you're getting comprehensive health care coverage. Consumers have several resources to find out about this plan, if they're eligible, and what the rates are, and also if their provider is in the network. You can check out this website. It's www.pcip.gov. It's very simple. The PCIP stands for the Pre-Existing Condition Insurance Plan Program. There's also a 800 number, and that gets you directly to a customer service rep that can help you locate where the application is, either online or they can mail one out to you. That number is 1-866-717-5826. And the call center is open from 7 a.m. to 10 p.m. Monday through Friday, Central Standard Time. Now on the website, I just want to direct you to, at the top of the title bar, you would click on Find Your State, and then a map of the United States will come up, and you can click on the state of Nebraska, or if you're in another state or want to find out information in that state, you would click on the different state. And you'll find information on the rates, the benefits, where the application is, and how to apply. Finally, I just want to remind folks that this is health insurance called the Pre-Existing Condition Health Insurance Program. It is for anyone who has been without health insurance the past 6 months and who has a pre-existing condition. And once you qualify, there will be no limits or exclusions on the comprehensive health care that you will receive. And if you think you qualify or you know someone who qualifies, please pass on the information, because it is vital that we get folks who do qualify enrolled for the program. Thank you.